Bills. We all get them, and I don't know anyone who really wants them. They are, however, a necessity in life. Medical bills are no exception to this rule, and it can be a bit scary when one arrives in the mail and you have to figure it out. Well, I'm here to tell you that you can figure it out, and I'm going to help you. First, let's talk about EOBs. That thing that comes in the mail from your insurance provider that looks like a bill but says it's not a bill. EOB stands for Explanation of Benefits, and it's a statement from your insurance giving you a rundown of what is paid by the insurance company and what you have to pay for. A bill is the one that you actually pay, and that will generally come from your provider's office. Receiving an EOB can feel overwhelming at times, but don't panic. You'll know what you owe when you get the bill that matches the EOB. Let's dive into a bill and what to look for and expect. First things first, who's the patient? Even though all bills can look a little different, you're going to find this near the top, typically under the provider's heading. And that tells us the answer to our next question already. The provider is usually the top heading on the bill and the first thing you'll see. This will typically include an address to mail in payments unless it's otherwise specified in the body of the bill. Many bills will include a table or grid that contains various bits of information. One of those bits, usually the far left one, will be the dates of services rendered. There may also be a summary on the bill that includes a date of service. Be aware that it can take a long time, sometimes weeks or months, to receive a bill after services are rendered. You can tell whether the service was in a hospital or an office in a couple of ways, depending on the bill. Some bills will have that summary we just talked about, and you might find that information there. There could also be separate bills from the same hospital or a physician who was consulted for care. The bill will indicate which type, such as a bill from radiology or a bill from critical care, for example. Okay, you've gotten this bill for services, but what are the services? Regardless of the bill's format, this information is typically right in the middle. Some bills will show it as a short, one-line description per service. Some will list it as a medical code or CPT code, and some will show both. CPT stands for Current Procedural Terminology, and those codes are used at every step of the billing process by all involved to let everyone know who's paying for what and how much. If you're not sure about a service listed on your bill, call your doctor's office for more information. And now, we arrive at the money. There are 4 things to look for when it comes to money in a bill: the total charge from your provider, what your insurance paid, what insurance negotiated down, and what you owe. These will usually appear as charges, payments, adjustments, and balance due. It's entirely possible that not all these elements are listed, but most bills will have at least what you owe, of course. Remember that when you see the tab, it could still be a sizable number. Lots of little services can add up to a bigger number, and insurance varies as far as what they will cover and how much they will cover. The next time you receive a bill or an EOB in the mail, you'll be prepared and know what you're reading and what you're paying for. Remember, if you have any lingering questions or concerns about your bill, you should call your doctor's office and just ask.